Okay, so I'm crooked. This is my first vlog. I want to speak about incompetent cervix. I learned of this condition the unfortunate way earlier this year. On Mother's Day, we learned that we were pregnant with twins. Our first pregnancy, our first try. It was pretty miraculous, and we've both wanted kids for a very long time, so having this opportunity was just out of this world. However, it came to a halt in July when I went in for routine ultrasound, and they then noted that my cervix was dilated 10 centimeters and the sac was bulging. There's nothing they can do at this point. Your cervix is pretty well not good enough to do its job, basically, because of the weight and the growth of the babies, and basically being incompetent. So what happens with this is many people go into preterm labor, either knowing it or not knowing it. In my case, I didn't know. And I've learned, and I've just learned through reading and what the doctors say. In any case, I am no professional about this. But what happens is your cervix shortens prematurely and then opens prematurely. And a lot of the times this happens in the second trimester when baby is not ready to come out. And sadly, that's how a lot of people find out about this incompetent cervix, also known as IC. It was pretty tragic, but I regret the loss, of course, but I don't regret the experience of carrying twins. It was beautiful. And a lot of people don't get the feeling of being pregnant, and I felt praised and blessed because of that. But with bad comes knowledge, which is good, because now we know what to do. And I'm currently 12 weeks pregnant now. And tomorrow I go in for the procedure to help my incompetent cervix. What this is, it's called a cerclage. It's a stitch. There are 5 different types of cerclages. I've really only investigated the most common one. To my knowledge, it's the most common. It's the McDonald. And it's basically just 2 stitches within your cervix. So baby stays in and doesn't come out, and hopefully no preterm labor. And baby can gestate. Of course, there are complications. It's not 100%. But we have hope this time. And like I said, knowledge. And a lot of faith. I feel better about this pregnancy. However, of course, I'm scared crapless because we really want this baby, as most do. So yes, the procedure's tomorrow. I'm nervous. It is said that I'm going to have an epidural, and from there, just basically get my stitches. It's a day surgery. They monitor you to see if it throws you into contractions or something like that, to make sure you don't bleed too much, things like that. But you're basically home the same day. After this, I will be on what they're saying is strict bed rest. So I hope to make these vlogs as much as I can. Another thing, we've decided not to have intercourse at all It's just safer. And especially with the stitching, you don't want any irritation or infection up there or anything like that. So it's worth it. I'm not going to lie. It's been rough, but it's worth it. And we can make up for it after anyway. But I'm excited about this baby. I think it's a girl, but I'm probably totally wrong. I do have faith in this stitch from all the reading that I've done, and I mean, 86% helpful, which I've read. I don't know how factual it is. I've just tried to dig out all the positives from this procedure to help me be ready. The baby is said to be due in June 2012, around the 20th. Now, a lot of times what does happen is because your cervix isn't working right, and like I said, the stitch isn't 100%, you can go into preterm labor around 28 weeks. And there's not much they can do to stop it. They can delay it, but it's not, those procedures aren't 100% either. Now, I've been toying with the idea of progesterone shots. I've read a lot about how they're called P17 shots or 17P shots, and you get them once a week. This is supposed to help strengthen your cervix and stop labor. This hasn't been 100% proven. A lot of women swear by it. So it's a decision I'm going to need to make really soon if I want to continue with these shots or not. Right now I'm just taking little capsules that you need to insert up your hoo-ha. And I do feel good about the needle and the shots. So I may be doing that every week as well as checkups every week to monitor the cervix and so on. As I was saying, I could go into preterm labor. However, there have been cases where the stitch comes out. They take it out around 36 weeks because they don't want you going into labor with the stitch in. You don't want to do further damage to your cervix. And you'd think the baby would pop out right away, right, when you take the stitches out. But no. I hope I'm one of those people that keep gestating. And the longer the better, right? I'm hoping this goes well. One baby at a time. But like I said, I'm excited. I'm scared. And hopeful. And I do believe that this should work and it should be okay. Anyway, like I said, my procedure's tomorrow, so wish me luck. I hope it goes nice. I hate needles, especially the said epidural. Friends have told me that it's not that bad, but they're in utter pain when they get this needle. So, of course, it's not that bad. I'm not going to be in pain. I'm just going to be numb from the waist down. Guess it's like a bad, I don't know, fell asleep on my legs type deal. I don't know. Well, I'll find out. But, yeah. So this is my first vlog. I hope I wasn't too scatterbrained about it. I know I'm all over the place when I speak about certain things. And good luck to the other mommies that I see on YouTube that are struggling with this same thing. I think it's important to be positive, and that's what we have to do. So thank you very much, and I'll see you shortly, maybe the day after the procedure. I don't know how well this is gonna go, so either way, I will update you and let you know about the good, the bad, and the ugly. Thank you, and